Okay, what have we got here?
58-year-old female with complaints of weakness, fatigue, impaired concentration, and shortness of breath for the past 2 months.
With symptoms so non-specific, I think you've really narrowed the diagnosis. I would also like to mention that the patient had a probable or confirmed SARS-CoV-2 infection over 12 weeks ago.
So you're thinking this presentation is long COVID?
The presentation fits the WHO Delphi consensus, UK NICE, and PHAC definition of post-COVID-19 condition.
I don't think the book is quite closed on this case yet.
Go on.
It's imperative we initiate specific biomarker testing to determine differential mechanisms and pathology.
Sir, I would like to also mention that I ordered the appropriate imaging studies for end organ damage, and lung CT and MRI findings were unremarkable.
Did you consider dual energy CT for perfusion defects? Brain MRI for olfactory bulb volume reduction?
Of course, in addition to gadolinium enhancement, cardiac imaging, AAP screening.
What about TCR and BCR analysis?
Enough! Before you spend egregious amounts of money on biomarker testing at my hospital, what part of your investigation have you left out?
Persistence in SARS-CoV-2 infection?
Nope.
Abnormal antiviral immune response during acute infection?
Wrong again.
Perturbations in systemic immunity.
I think it's time we place bets on this.
Sir, is it sarcoidosis?
Well, now I know how the boards are going to go. Vaccination.
To ameliorate symptoms.
Association with symptom exacerbation because of de novo long COVID.
Going back to what we know about vaccinations, what do they do? What do they do? They reduce the risk and severity of infection, especially in high-risk individuals for the disease in the first place.
I have many patients in my practice who are suffering from post-COVID condition. I have patients who have neurological manifestations, chronic fatigue, cardiac issues. It's such a broad range of affects that can happen post-COVID.
Patients come in and say to me, "Doctor, I have extreme fatigue. Little things I do make me tired."
Unfortunately, these are patients who I do not have great ability to treat, and neither does the healthcare system at large. And even the pathophysiology of the underlying condition is still under a lot of investigation.
You see patients like this, and there really is no answers for them.